Doc, I'm hoping you can share some information on hemorrhoids. Yay. Okay. So what are your thoughts on banding, natural supplements? Would it be greatly appreciated for those out here who suffer with them? You know, hemorrhoids are interesting because it's an aneurysm. It's a tear in the venous wall, right? So varicose veins, hemorrhoids, aneurysm, they're all kind of the same animal. They're just in different parts of the body. There are several herbals that are really, really, really good at calming them down. Witch hazel, all that stuff we're all familiar with putting on topically. You can do the preparation aids, all that's fine. Depending if it's internal or external is where you're really looking at. If the thing drops down, you got to push it back up. Sorry, that's the reality of it. Do it clean, wash your hands, etc. But you've got to push it back up. There are two little sphincters in there, okay? And you've got to get them to tighten. And the easiest way to do it is to tighten the pelvic floor. And there's several different exercises you can do to tighten the pelvic floor. A couple of them come out of old Taoist medicine that I like. I'm a big fan of it. They got lots of cool exercises for stuff. So you do your Kegel that you're all familiar with, but you take it a step further. It's not just Kegel. You have to do almost like in the rectal tissue, you have to almost like it's puckering up. So you have to do a Kegel and a little pulling up and in, and that pulls up the abdominal floor. They call it Dao Yin in acupuncture, and it just means an intentful thought on what you're doing, right? So Dao Yin is giving an exercise, an intentful thought on what you're doing. So if you think about that, you say, okay, I'm going to do my Kegel, I'm going to squeeze that Kegel, which is how you stop urinating, right? I'm going to squeeze that Kegel, that pelvic floor muscles, and I'm going to do that little up and in. And as you pull it up and in like that, then you want to hold that as hard and as long as you possibly can. And then let it release. I would try to do it 3 or 4 times. I would do it 3 times a day. As you start doing that, you're going to start regaining an integrity to the muscles of the pelvic floor, which will then start taking stress off of the prolapse and things that might be going on down there. You also got to be careful sitting for too long. Toilets are renowned for this. You sit on the toilet too long, reading a magazine, you're just asking for it because the seat itself is putting a tremendous amount of inward pressure on you. So you want to get your business, get on, get done, get out of Dodge, and that will help a lot. And then there's a couple of nutritional things you can throw in there internally, white willow, things like that help a lot.